think the moment we've been waiting for since the employer trends report dropped yesterday. A discussion between Beth Holmes, our head of Hint Connect, and Dr. Ben Aiken, the CEO, founder, and family physician of Lantern Health. They're gonna come up here and talk about all those trends, so be prepared for lots of data. We'll also share the QR code to download the trends report again at the very end, so you can read through it yourself.
All right, everybody, welcome. Feel free to come closer. I think we're going to be pretty friendly today.
I think so.
So come have a seat. Hopefully some of you have seen Dr. Q's talk earlier and Zach's talk earlier, because they're going to fit in really nicely with what we're going to say today. So Jocelyn, thank you for the introduction. Just a little bit more info. I'm Beth Holmes. I lead our Hint Connect team here. Hint Connect allows DPCs nationally to come together and work with larger employers. So we have some experience and actually contribute to some of the data that we're going to see today.
Great. My name is Ben Aiken. I am a family physician. I've been DPC for about 8 years, and about 55% of our clients have been employers for the bulk of that time period. And so through that work and some work over the better part of the last 3 years for a company called Decent, have spent a lot of time thinking about the employer space, and I'm happy to be here today.
Great. So this was a talk that we gave a couple years ago. Actually, Ben was on stage with a couple other people about employer trends in DPC. And when we talked about it 2 years ago, it was new. It was the first time we had analyzed the data, because we were seeing a surprising trend that a large portion of DPC memberships were employer-sponsored. Back to Kenneth's talk this morning, DPC really started as a retail-only effort. And so this has been a really interesting trend for us, and we're excited to talk about what we're seeing today. A lot of it is a continuation of the trends, but there's some new information that we want to share with you. So we're hoping that you come out of this talk with an understanding of the trends today. If you're a DPC, an understanding of how to start working with employers, and from Ben's perspective, what it's like being a DPC that works with employers, and how that's going. So a little bit about our data. We have data for over 1 million members, over 7,000 employers, over 2,000 DPC clinics nationally. And so this is absolutely not the definitive picture of all DPC data in the United States, but it's a pretty representative picture, we think, of what's going on. So we wish, if there's ever the opportunity to put it together with other data sets, we'd love to. But there's a lot of data in here, and we think it's really representative. We do kind of trim down our data to make sure that we're looking actually at the definition of DPC, true employers. We're not looking at concierge. We're not looking at virtual here. So this is a pretty good picture of what's happening. I want to start with talking about DPC practice growth, because you have to contextualize the growth of the DPC movement when we talk about employer trends. Since 2017, we've seen a 25 to 30% growth rate year over year, even through COVID, of DPC practices. So what is possible now with employers was not possible 5-6 years ago. And looking at this data, even since about 2022, the number of DPC practices has doubled. And we don't see a slowdown. We actually see a little bit of an acceleration of that. So that, I think, frames what we're going to talk about today. But as you can see from the map, the distribution of data, or of DPC, is not equal. There are some places that DPC per capita is quite high, Colorado being one of those states, thanks to kind of early and multi-site locations like Nextera. And there's other places like where I'm at in California where it's really still nascent. So it's not distributed equally yet. The first data point we want to talk about is the proportion of employer-sponsored DPC memberships. So when we talked about this a couple years ago, we were just about at 50%, saying just about 50% of DPC memberships are employer-sponsored. Now it's almost 60%. So that was surprising for us to see. It continues to grow. Ben, reflecting on this data, are you surprised to see this? Does this mirror what's happening at Lantern?
Yeah, it overall is not surprising to me. I think if we take a step back and look at the broader landscape of care delivery and health benefits at a national level, half of Americans, 150 million people, ballpark, get their health benefits through their employer. It's the biggest payer of healthcare in the country. The next closest, I think last time I looked, is Medicaid at around 80 million, and the biggest commercial payer is somewhere in the 50 or 60s. So this is a large number of people that get their care through their employer. And those employers are facing the same premium increases that everyone else is facing and really trying to navigate pathways to do it better. And so this really, to me, reflects that employers are seeing the data come out and really recognizing that DPC is this compelling alternative to the status quo. And so I expect this actually to continue.
Yeah, and the growth of retail is it's still growing. It's not decreasing. It's just that the growth of employer is outpacing that. And one of the kind of interesting counterpoints to this data, which we see, is that the proportion of DPCs who work with employers has actually gone down in the last couple years. And when we looked at this data under the hood, it was around 50% for several years. When we looked at this under the hood, the number of DPCs that work with employers is still going up. But the number of new DPCs that are coming into the market has increased. And it typically takes a new DPC 12 to 18 months to land their first employer. It's a longer sale, it's a more complicated sale, you have to know different buyers, there's a lot of reasons for this. So I think the question is, with this data, will those new DPCs eventually start working with employers, or could we see a trend kind of back to DPCs working exclusively with retail? What are you hearing from new practices that you talk to?
Yeah, I mean, I think it's a really good question. And initially seeing this data, I kind of was a little bit perplexed. It surprised me, but when you dig underneath the surface, it makes sense. Most of my reflections here are anecdotal in terms of the Lantern experience, and then also the lived experience of navigating a network as part of the Decent team when I was in that capacity. And I would say that the new entrants to DPC seem more open to employers than the entrants were 5 years ago. And that has been really consistent across almost all the conversations. Folks are recognizing that this is a more viable, sustainable path to be in primary care for a career, and are looking for ways to grow their panel as efficiently and quickly as possible. And there's enough of us in the DPC space nationally now delivering care to employers that it's one of the questions that generally comes up first when I'm having those conversations with new folks coming into the space. So I feel that is really positive in terms of continued adoption. Mm-hmm. And then it's getting into the kind of the logistics of, well, hey, how do I do this, and how do I get as close to day one and launching with an employer as possible.
Yeah. Do you have any advice for new practices who are looking for that first employer? I know, like, going to your local chamber, going through the Hint Health Boot Camp, talking to other DPCs is the advice we typically give, but is there a way to accelerate that first relationship with an employer so that you can get the experience and build off of that?
Yeah, I mean, I think it's a really good question. We were very fortunate the day we opened, we had one employer that already committed with 50 lives, and that took some time to build that trust in advance. So I think a couple thoughts. So one, I think it's easier now than it was 2 years ago, 5 years ago, 8 years ago. There's more awareness in the employer community about this as a pathway, and that is, to those of us in DPC, that's to our advantage. DPC, I think most of us in the room recognize, is a pretty open source community. Like, there are resources that are available for free to almost all of us to try to optimize our practice, do things better. There's books that have been written about engaging with employers, and all of those things are available to all of us. So certainly use those resources. That has not changed. And then I would say that, there's really we'll talk about this later, there's some really compelling opportunities with the bigger employers, and we'll speak to that later. But I think if you're a new DPC and you're launching your DPC, find that small business that's like a really good fit, develop that relationship, and try to get them on board early. It's overall pretty low risk to them. I mean, talking like maybe they have 5 employees, maybe they have 10 employees, but start somewhere, because as soon as you start with one, they're willing to take that chance, then you've got a story to tell to the second. I mean, if you do the job that I expect you will do as a DPC, they're going to tell their friends too. And so I think sometimes those of us that are coming into DPC, like we try to build the airplane when sometimes just what we need to do is walk from point A to point B. And don't forget that, like lean into your local community. Like we talk a lot about community-owned health plans in this space with our Rosetta colleagues, and lean in on that. So maybe it's somebody that you know that has a small business. Start somewhere and begin that relationship even before you open the doors. And I suspect you'll find somebody that will be willing to give you a chance.
Yeah, and I'll just shout out that we have a lot of resources on our website about the benefits of DPC for employers, and it's open source. You can take it. It's not just Hint Connect. It's not just Hint. It's general, and so take what's out there, use it, make it your own, and definitely recycle what your colleagues have done to tell the story.
Beth, one more thing I want to add as it relates to kind of a different landscape for new people and existing folks in DPC is that just did not exist when I started is the concept of a DPC network. And I know network in certain circles is a bad word, but there's really great potential in what we're seeing emerge from a DPC network perspective. We are a part of DPC networks, Hint Connect, Aligned, and other affiliates. But there is an interesting opportunity that for you as a DPC is effectively very low lift. You generally have to review a contract that has been built to be compatible with DPC, and you can enroll in these things prior to even opening, arguably, and then somebody else is in effect doing the sales, somebody else is going out and trying to engage these employer clients, and they may be able to bring a life to you or a handful of lives, but that's another kind of emerging way that really is, we're seeing pretty great potential that you can engage with employers right out of the gate.
Yeah, and I think we'll talk about that as we look at business size. So in our last report, what we saw was the majority of employers working with DPCs are small. This is employer sized by the number of enrolled members, so the actual number of eligible members may be larger, but the majority, I think 75 or more % of businesses that work with DPCs are small. So those are those under 50, they don't require ERISA compliant benefits, they're fast, kind of essentially fast decisions, one decision maker deciding to go with a DPC in their community. And that's what's driving a lot of employer-sponsored DPC. Is this similar to what you see in your practice, or are most of the businesses on the smaller side? Do you work with any larger businesses?
Yeah, I mean, it's a great question. I think our breakout mimics this very closely. We have just over 70 employers that we work with. A good number. I think, the type of community you're in, I'm in a tourist town, we have a lot of small businesses, so we certainly skew that direction. Our largest employer has about 650 belly buttons on their plan, and we take care of a portion of them. And so we see that that's kind of the range that we're in.
Yeah. What do you see in terms of selling to a business of different businesses of different sizes? Because I know with Hint Connect, we primarily work with the ones that are kind of 100 and above that are self-insured, and they're buying for cost savings, and they expect data, and they typically need multiple sites, at least a handful, if not a lot more, and we're deeply integrated into the plan. So that's kind of one that they have a certain buying motivation, but what about in kind of the 10 to 100 space? What do you see there in terms of what they're looking for, why they're buying DPC, like what's the in with them?
Yeah, I think it's a mix. I think that we can, I guess, make some generalizations about certain size, but just as a reminder, I think most of us in this space are somewhat nerdy at heart, and I think have this tendency to study all of this in a lot of depth and then kind of lead with an idea that we think may be a good fit for an employer. And I would just encourage everybody to actually ask first. So that's the first point and kind of the main point, which is when you're meeting with an employer, if they have 5 employees, like ask them what they're really interested in, and most of the time they'll be able to tell you. And the same would be true for an employer with 100 lives or 500 lives. Like ask them, because we have some employers that have 100 lives and really are looking to kind of keep a distance from their health plan. They don't want to engage and go down the self-insured path. They've heard of this DPC thing, but they still want to keep a distance. And we have employers with 20 lives who are trying to self-fund and create the most innovative plan that you can imagine, and driving hard towards that with an aligned consultant. And so in time, I think once you get to know your community and you really start to listen, you'll develop the skill set to be able to kind of have answers depending on what they're interested in. From a generalization perspective, the small businesses, a lot of them are just looking to offer something like DPC alone, or maybe DPC in partnership with a health share. The employers that are in the kind of 40 to 100, 150 are, especially those that are facing increasing premiums, are really starting to shift more interest towards the self-funded space and how does this pair. I think a lot of us in the room are super excited about this opportunity for HSAs to now be involved, and I think employer interest in that space is going to be really high looking towards January of 26 and forward.
Yeah, I think that takes us really nicely into the next slide, which is, although most of the businesses buying DPC today are small, the growth rate for larger businesses outpaces that of small businesses. Larger companies tend to offer and have more people enrolled in HSAs, so the new legislation opens that up more. We certainly have seen an increase in larger businesses interested in DPC, not just those mid-sized businesses in the 1,000 or 100 to 500 range, but really big businesses, Fortune 100, Fortune 500, who know about DPC. They're researching it. Their buying cycle is 2 or 3 years, but it's on their radar, and they're looking for DPC or DPC-like options. And I think that the DPC community should know that that's who's looking at DPC now today too. Do you see more bigger businesses interested in DPC, or how is that playing out for Lantern?
Yeah, I do. I think that we are a multi-site DPC, and I feel like have been serving employers for 8 years, but we are still not in a position independently to go out and court these businesses that are 5,000 lives, 10,000 lives, 50,000 lives. And so the networks that I spoke to earlier are really, and Hint Connect is included in that, are like really well positioned to really start to land those contracts. And I think, what we're seeing is kind of two things beneath the surface. So we've already seen one, reflecting back to, I think, the second or third slide, you saw that footprint of where DPC exists nationally. So we still have a lot of work to do on DPC supply, but we're far enough along that if you are an employer with multi-state and remote workforce, whatever, you've got folks that are covering a large footprint in the nation. You can look at a map like that and not freak out, and actually maybe say like, wow, actually this could be a viable option for us. So that's one factor that I think is driving this. And the second is that even though it's early, we have data that's starting to emerge that is suggesting that this is actually a better experience and drives savings. And big employers have been monitoring that for a while. We heard it from Dr. Rashika earlier, in the sense that these big employers really aren't going to make a call on something like this without data. But we have enough data now and enough case reports that they're seeing it and willing to give it a shot. So those two things combined make it a really exciting time from my perspective.
Yeah.
For the big players to get in.
I agree with you on the data. I think we've reached a point where we have enough studies from from DPCs, from independent organizations, from large employers that are saying the same thing. And I encourage DPCs, as you're looking at your own data, we heard from Mehul earlier, as you're working with organizations like Health Compiler, publish your case studies, put them out there, let other DPCs take advantage of them and use them, because I think we have so much data, but it's really not in one place. And if it were, we would have a much stronger picture out there of what DPC is actually accomplishing. And I know Fritz was here before, but plug for Milliman. They're always looking for claims data and results to put into their analysis, which I'm sure will come out soon. DPC by industry. We saw the same thing in the last trends report, which is that everybody's buying DPC. There's not one industry that is only investing in DPC. And sometimes I'll hear a conception from brokers that this is for businesses that are kind of have higher paid workers. This is more of a concierge benefit. And what we've actually seen in the data is the opposite. The industrial segment has outpaced the public segment from the last report. So that and kind of consumer, which includes food services, consumer goods, so retail. So not necessarily, white collar, even gray collar folks are the ones that are benefiting from DPC. So what we see from the Hink Connect side is that industrial segment has a lot of older workers, typically male workers, a lot of people who are skeptical of the traditional healthcare system because they've been burned by it, because their doctors have retired, they see a different kind of doctor mid-level every time they go to their clinic. They have to re-explain who they are, what their conditions are, and they don't want to do that anymore. But they're not getting healthier without healthcare. And so giving them someone in their community who knows their community, who they can pick up the phone and call, they don't have to necessarily download another app, who's gonna know them when they go in, is a really powerful way to get them to engage with their health. And like Kenneth said, have a doctor in your family, a doctor in your pocket, someone who cares about you. So that message is really resonating, I think, in the industrial segment. But Ben, to your point earlier, every company is different. They're buying for different reasons. And even within these segments, employers are going to be buying for different reasons. So you mentioned there's a lot of tourism in your community. Are a lot of the companies you work with supporting that industry? And what do you see in terms of different buying motivations by segment?
Yeah, I think we have seen folks across the segment based on where we live. We take care of the biggest segment is restaurants. And then we have artists, we have local hotel workers, folks that are, again, in the service industry that historically have pretty bad access to benefits. And so in that segment, a lot of this, they've actually not had any benefits. And so just starting with something as simple as DPC, even if those employees then have to navigate their own plans on the marketplace, actually feels like a real win to the employer. And so, again, I think just listening to the population you're serving is super important. One just quick tangent I love, it's a little vote for those of us who work in hospital and healthcare, we're buying what we're putting out there, right? The biggest segment in here is hospital and healthcare. And I think that actually speaks and validates for me what we're up to. If those of us in this industry are actually paying for this more than any other, rah-rah.
Do you think that DPCs, have you ever seen a DPC kind of have a niche in terms of the industry they serve? Or, how could a DPC essentially carve out an industry to focus in if they're starting off?
Yeah, I think it comes back to listening to who you're caring for. And I think we heard an example of this in the previous talk where, in essence, they built in, Shika's team built in a physical therapist because there was clear demand from the team. They're supporting a couple examples for us. So one, we have a manufacturing company that tends to be very positional and you're holding a position for the bulk of the day. And one of our physicians also has a fellowship in sports medicine. That was a really big part of the conversation with them and something they felt very attracted to, that they would have access to that additional expertise in partnership with primary care. Another example is a business that's led by somebody who's really focused on lifestyle medicine and trying to keep his team as healthy as possible. And we have health coaches on our team. We've had that since the beginning. It's a clear area of focus for us. It may not be for others, but that was something that really stood out to and we leaned in on. And so in comparison to some other groups, that health coach actually sometimes goes on site and leads certain sessions. And we do that specific to that employer. And so it's that adaptability on top of kind of a basic standard level of service where it's not overly burdensome to us as the DPC, but allows us also to feel a little bit more special to that specific employer we're trying to serve, that I think is relevant across the country.
So we have a lot of data in the employer trends report beyond what we're going to show in these slides. The last couple of slides we have are kind of geared more toward DPCs considering working with employers and what they can expect and what that experience is like. So this shows the member age distribution that we see in retail versus employer membership. And the biggest finding, which may not be surprising, is that people tend to be more working age and you see fewer seniors. What I hear from DPCs is that there could be a better risk spread in employer membership. You tend to get more people maybe in the 20 to 30 segment that wouldn't necessarily buy a DPC membership on their own, but have it through their employer and may access it differently. So what has your experience been in terms of both the age distribution or relative risk of the members you're getting in through employers versus what you see in retail?
Yeah, I think this reflects it well. Overall, I think if those of us that are in the space of selling to individuals have had the experience that if you're talking to a 25-year-old who is invincible, and we all in some capacity were there at some point in our lives, it's harder for them to kind of grasp this idea of, wow, I've got to pay this monthly fee, like, even if I don't really need you. We have a spiel to give them related to that because we think there's value there. But hey, I'm, in my late 40s and I've got 3 chronic conditions and I'm starting to feel achier every day. Like, wow, I actually think I could use this and really get some value out of it. And so that sale really kind of sometimes skews for a lot of us in DPC towards that. In the employer space, you're getting folks that really are working age up, so 20s forward. And so I do think it balances it out. I think it also, just one point of reflection is that, like, I would argue that our 25-year-old restaurant workers are generally not the healthiest people. And so, one of the beauties of DPC is it really kind of, it's a systematic way for us as clinicians to sit in front of a patient and then just do what's best for that patient, right? Like, that's the way the incentive structure is aligned, and there's really deep power in that. And so it's actually great if I have a 25-year-old that's really sick, uses lots of substances, has terrible sleep schedules, et cetera, is really stressed. Like, I'm going to do what's right for them, and it's going to be more work, but that is actually really works well from my perspective. So I think the point is yes, at a broad level, like, this can help you kind of spread the risk, if you will. But the other point is that, like, really the beauty of DPC is in really doing what's right for our patients. And so, just know that, like, I think that involves work kind of no matter the age.
Our final slide here is about sponsor retention by employer size. So when DPCs consider working with employers, the benefit is a lot of members at once. The risk is a lot of members at once. If you take on too many members with one employer, they could leave, and that could have significant impact on a practice. And we've heard of that, tanking practices. So we looked at sponsor retention after 12 months and 24 months. I think overall the picture is good. Most businesses stick with DPC. It tends to be a little stickier on the larger side. So I think bigger businesses hopefully are a little bit more stable. They tend to not switch up benefits as much. And I think when they choose to go with DPC, they're sticking with it more. But what I've seen in terms of the reasons that employers don't stick with DPC doesn't usually have a lot to do with how that DPC is performing. It has to do with the team that leads, whether there's a turnover in the team that leads benefits, a turnover in brokers, how the company is performing financially in their core business. Are there investors that have kind of made a change in the business? So DPCs should think about churn and what would happen if the businesses they work with churn. What has your experience been with kind of the retention churn dynamic? Because you've been working with groups for 6 years or more now. So what does that look like for Lantern?
Yeah, I think overall, I feel like we've been very fortunate. We have now approximately 70 groups, and in 7 going on 8 years of doing this, we've lost 2. One, the business folded, a small business. And the other, which actually, was one of our original clients, and, some lessons that we learned from this, we lost them last year. Interestingly enough, the CEO, the COO, and their families stayed on as individuals, and I think we will get them back for January of next year, which feels affirming. But in essence, kind of we were a little bit lackadaisical of kind of being at the table on a consistent basis and making sure that we were part of that conversation. And they were working with a broker who I would just say at a high level is kind of the opposite of the brokers that you will see and experience at an event like this, who basically said, hey, I'm going to give you a cut on the 40% premium increase to 30%. I'm really your advocate, and you got to ditch this DPC. And we weren't at the table, so our fault there, and we lost them. And so, I think that in our community, again, like we have structured it so that if our biggest employer left tomorrow, it would be painful, but it would not impact the business in a significant way. And as we engage in this really higher size employer, that conversation may shift a little bit. So, if you're earlier in the DPC movement, kind of trending towards those smaller employers may make some more sense just from a risk perspective. But overall, our experience has been that it's definitely worth it.
Yeah. Great. I know we're getting close on time, or we're over time. I think Ben called it when he said we're nerds. We love to talk about this. I would love to continue to talk about this. So do we have time for questions? I don't know if there's anything else happening here after this. Jocelyn? Go for it. Okay.
I'm curious if you have any sort of like notice requirements for those really large employers to be able to get out of the membership, to give you time to, get new memberships. I'm just curious if you had any experience with that.
Yeah, I think it makes good sense to set some parameters around it. At a high level, I would say for the employers that are in the space of 20 to 100, that for us, I think it's 90 days is what we ask. And then, if you're getting bigger than that, you will see, and we usually ask for a 1-year commitment from those employers. Some of our small businesses, maybe it's a little bit laissez-faire. We actually don't have contracts at all, so they could leave. That hasn't really impacted us at all over 7 years. But the bigger employers, I think you should start thinking about having a 3-year contract or more. I think Rushika said they had 5-year contracts and plus. And so when you're getting into the bigger space, you should probably have a longer lead time and a longer contract.
I'm curious if you're seeing any trends toward consolidation in the DPC space with practices, and if so, what factors are driving that?
So that's not something we looked at specifically in this report. What I would say is the trends that I see are that more DPCs are hiring. So I don't see consolidation across practices, but I do see growth in kind of an employer MSO model. So DPC practices are getting bigger, but it tends to be incrementally bigger. Like Zach showed before, if you're able to see his talk, we see a lot of essentially network effect. So even at a very small level, one DPC working with 2 others in their community. At a bigger level, bigger networks, national networks, bringing DPCs in together. So I have not seen a lot of DPC consolidation either in our data or anecdotally. I don't know, have you?
Yeah, I think it's a really good question. A little. I think we're starting to see it, and I think we'll see it continue. And I think, I don't know, if for every 10 prospective DPC doctors that I talk to, 9 want a job and 1 wants to do their own thing. It's just been my lived experience, and it's really shaped our approach at the DPC level to grow and replicate and provide opportunities for doctors to come in. And I think when we're now starting to get this traction, there are some, I don't know if economies of scale is the right way to describe it, but some potential things that, hey, I've been, as an example, I'd say I'm 5 years in and I'm doing some administrative things that were fun and interesting for the first couple years. And then I realized as a doc, well, hey, that's not doesn't really fill my cup. I've done that. And is there a way for me to partner with other people so that, we can collectively have somebody that's serving as our fractional CFO or something like that. And so I think there are some forces that are driving towards that. And I think, frankly, a lot of the really entrepreneurial DPCs see a real opportunity to increase their impact by partnering. So I think that we'll see more of it, even though it's early.
Yep. So if you haven't already, feel free to download the report. contact us with any questions, any observations, any typos you see. And yeah, we appreciate you coming out today. Come to the Hint Lounge by I think it's Ballroom C if you want to talk more about this. But thanks everybody for coming today.
Thanks so much.